children. We're here to cover the crisis around measles, and we put together a great panel of experts, pediatricians, and others that are very interested in what's happening in our state around measles, and we think it's going to be a lot of good information. Joining us today on our panel, Terry Burke, who is the Executive Director of the Immunization Partnership, Dr. Marcia Griffin, who's a professor of pediatrics and director of the Division of Child and Family Health at the University of Texas, Rio Grande Valley, the School of Medicine. She's practices medicine down in the Rio Grande Valley. Dr. Michael Chang, who's a pediatric infectious disease physician, UT Health Houston. Thank you for being here, Dr. Chang. Dr. Gilbert Handel, who is a professor at the Department of Pediatrics and Pediatric Infectious Diseases at the Marta Cuellar Chair for Child Advocacy, Texas Tech University in El Paso. Dr. Handel, thank you very much for being here today. Also from the Deputy Public Health Authority at the Houston Health Department in Houston, Texas, Dr. Janina White. Dr. White, thank you very much for being with us. And then para algunos palabras en español, Dr. Gaby Segura. She's assistant professor and specialist in pediatric infectious diseases at the McGovern's Medical School, UT Health Houston. Dr. Segura, muchísimas gracias por estar aquí. I just want to sort of preface all of this by saying that, this disease that we're talking about, measles, I remember my parents and their parents talking about how it was so contagious that most kids just imagined during their time that they were going to get measles. Most kids would have measles by the age of 15. At that time, measles claimed many deaths, over 50,000 hospitalizations annually, about 500 deaths. All of this was usually in children, brain inflammation that affected kids. And when the first vaccine was introduced in 1963, we saw a dramatic drop in the number of measles cases. And by 2000, basically, we were saying that measles had been eradicated in our country. In the last 10 years, there's been no death in regards to measles until the death this year in Texas. And so now we have this current surge happening in our state with close to 200 cases last time I looked, and one death. And it becomes alarming to us as we look at this, because one of the things that we understand about measles is that it is the most infectious disease in the world. It's the one that if you're not vaccinated, you're likely to get the measles. And measles will last up to 2 hours after you leave. After someone infected with measles leaves the room, it'll last up to 2 hours long. It's highly infectious. It has a high hospitalization rate, a high brain inflammation rate, and a high death rate. And so we have this disease right now here in Texas. And what's interesting is that if we were to ask our parents what to do, they would let us know exactly what we need to be doing. It would be getting a vaccination. Currently, when we look across the state of Texas, only about half of Texas counties have that community immunity or herd immunity rate of around 95% of our children being vaccinated. When you look at many charter schools in our state, the number is only around 50% of the kids that are vaccinated, and that becomes alarming at certain schools. When we look at rural areas, one of the things that we see and that we're worried about is that there aren't enough primary care providers within a 50-mile radius for a lot of these children, if indeed they get infected. And when we look at vaccination or vaccine exemptions, we see that that number continues to grow. And we get, right, that after COVID, you saw a lot of vaccine hesitation. But I think in this case, we're talking about something that's been around since 1963 that we saw was very, very good. And it's something that we really recommend that parents, if they really don't want their kids to get sick, to get brain inflammation, to potentially die, this vaccine is very, very important. I once heard someone say that there's a study that could prove any viewpoint, but I think in this case, there is no study whatsoever that shows that the measles vaccine is bad for you. There is no study that proves that viewpoint. Sometimes when you listen to the news, you hear a lot of, well, maybe, or maybe this, but as parents, really all we care about, what is the best advice from the best people? And the best advice from the best people is that you have to, and the best people are pediatricians. And the best advice is that when you across the state of Texas, there should be no pause, there should be no doubt. The best advice is get the measles vaccine. And make sure you're not hanging out with families that don't have a vaccine. Uh, my parents and their parents didn't have these options. All parents want to do is the right thing. And the right thing to do is to not let your kids get measles, and we have the solution for you. So I want to talk to I want a couple of our pediatricians to say a few words. But first, I want to go to Terry Burke, and we're talking, Terry, about measles, el sarampion, as is known in the Latino community. Give us sort of your take on this, Terry.
Sure. Thanks so much, Bob, and thank you all for doing this today. It's so important. The Immunization Partnership is really the only one in Texas solely focused on educating and advocating for sound public health policy around immunizations, and it's been challenging in recent years. While visiting with a legislator at the state capitol a few weeks ago, I introduced the topic of the measles cases in the South Plains. She and I are probably close to the same age. And she said, well, we're just talking about the 3-day measles, right? I mean, like we had when we were kids. She was referring to rubella, a dangerous vaccine preventable disease, but it's just not as life altering as, or even as fatal as measles. She likely had that reaction because most folks believe, as Dr. Bob just pointed out, because measles was considered eliminated in the year 2000. Eliminated means the disease is no longer constantly present in this country. But many countries, many parts of the world, still see the measles. So even if your family does not travel internationally, you could come in contact with the measles anywhere in your community. And if you live in places like Houston and Dallas, which are incredibly international cities, we see travelers coming in and out of our city, out of our airports every day from around the world. And so measles can easily be brought into this country by unvaccinated travelers, mostly Americans and sometimes foreign visitors. In fact, last year there was an outbreak in Philadelphia that was the result of a exposed person from London flying into measles, flying into Philadelphia with measles. They flew into the measles too, but when that happens, anyone who is not protected against the measles is at risk. And as it's been discussed, it's so much more than just a rash. 1 in 5 people in this country will be hospitalized with the measles if they're not vaccinated. 1 out of 1,000 will develop brain swelling, and that leads to brain damage. And 1 to 3 out of 1,000 people will die, as we saw 2 weeks ago in the Panhandle. None of this has to happen. Misinformation and disinformation campaigns have led to skepticism and outright opposition to vaccinating children, and it just doesn't have to be that way. Vaccines are life-giving. Every day that a parent sends their child out the door, they know there are countless things that could happen that they can't prevent, from bullying to a bus accident to a shooting. The one thing they can absolutely prevent is their child contracting a serious contagious disease. The MMR, measles, mumps, and rubella vaccine that's been around since 1971 is the best protection against measles. It has long-lasting protection against all strains of measles. So if you have questions, if you're hesitant, talk to your pediatrician and ask your questions, and then vaccinate your child. And finally, tell your legislators not to mess with the state's vaccine requirements for school admission. We don't need to see these numbers declining. We need to see them going up. Parents have the freedom to protect their child as they see fit, but schools and government have a duty to protect every child.
Thank you so much, Terry. So appreciate that, your words. Let's go down to the Valley. Dr. Marcia Griffin is here, professor of pediatrics at the Rio Grande Valley School of Medicine for UT. Dr. Griffin, give us your take, on this and what people are seeing down in the Valley, in the Rio Grande Valley.
Oh, thanks so much, Dr. Bob. I recently retired. So, but I claim the Valley family and the border will never leave me. So I want to thank you for including me in this illustrious panel, and all my colleagues for being here, and Terry for your important, emphatic words. I want to say, when Terry went into her position with immunization partnership, she called and we were talking, and we just published an op-ed that was picked up in several papers about talk to me, Marcia, about hesitancy on the border with the families that live down there. And I said, what hesitancy? The families that I took care of in a federally qualified health clinic, Brownsville Community Health Center, they wanted their kids vaccinated. And the beautiful thing about practicing on the border, and Dr. Handel can attest to this as well, is the beauty of the people and the beauty of the culture. And there's nothing more important to them than their kids. And they want their kids protected. And they trust their pediatrician to help them figure that out. And I was asked today to talk about some of the challenges of living and working on the border, or in rural areas, or in urban places, urban pockets where lots of people live together. Families take care of each other. And so on the border where I practiced, a lot of people lived in colonias, which are not so fancy suburbs of the cities, but they were on former farmland, and many of them today still do not have running water, do not have electricity, they do not have trash pickup. If you don't have water, you can't always wash your hands, much like places in India or any third world country. If you don't have electricity, you can't keep your medicine. If you don't have trash pickup, you're burning it. One of the colonias that we're putting midwifery services in right now is going to one of these colonias who just recently got sewer. And so this is the reality, and they live in little houses behind the other house, or double wides with 16 people in them. And there is no way to quarantine. And what contracting measles means, you have to be quarantining and keeping people from the rest. Like COVID, when something as infectious as measles come in, and you have a community that lives in very crowded housing conditions, which could be the inner city of Houston, or it can be the border, but that is like a tinderbox that's going to go off. And so what I would say, and I am speaking to the health providers today, is that your population. Find out and make sure you know how many people are in your house, and do any of them have to have special precautions? Do you have another child with cancer? Do you have another person in the home that's immunocompromised? We saw it with COVID with diabetes, and diabetes is immune suppressed, really not suppressed, but they have a higher risk of serious disease. So find out who's living in their house, and how that we could work around quarantine if their child is sick. So getting that message out, I think the good things in the areas where I practice was, God bless federally qualified health centers. God bless the free clinics that are down there helping to supplement that, and the mobile clinics that we send out, because most of these families don't have a car, they share a car with other families. So getting to you in your clinic is hard. So we have to be working with our public schools of public health, and in the Valley, it's Texas A&M School of Public Health and the University of Houston School of Public Health. And so we need to be in conversation with them as healthcare providers. And in any way we can, be getting the message, vaccinate your kids, vaccinate your children, and have a plan. Have a plan. So thank you. Thank you so much for letting me be part of this.
Thank you, Dr. Griffin, very, very much. Let's go to Dr. Michael Chang, a pediatric infectious disease physician over at UT Health Houston. Dr. Chang, thank you so much for being here. Give us your take on this, Dr. Chang, on the measles.
Sure. Yeah, I was going to talk briefly about symptoms and treatment that parents think about. And so, as mentioned, measles is one of the most highly contagious respiratory viral infections. It starts classically with high fever up to 106 degrees Fahrenheit, extreme irritability, and then runny nose, which is also known as coryza. After about 3 to 4 days of symptoms, then the rash appears, spreads downward from head to toe. And then after the rash starts, actually symptoms may last another 7 to 10 days for a total of 3 weeks of symptoms. And as mentioned, it can lead to severe complications such as brain infection, pneumonia, and death. And it can also suppress your immune system for many months after. So parents should seek care if their child develops lethargy, dehydration, decreased mental status, or for persistent fever over 102 degrees Fahrenheit. And then please let the medical staff know that you're worried about measles because we have to use special isolation. So I want to emphasize there's no antiviral treatment for measles, and vitamin A is not an antiviral. So while vitamin A has shown some mortality and morbidity benefits in malnourished children, its role in healthy children is not clear. Vitamin A in high doses actually can lead to serious toxicity, including increased pressure around the brain, vision problems, seizures, skin, and liver problems. And it's also known to cause birth defects in pregnancy. So again, the benefit of vitamin A for measles in children is not, in normal children is not known. And it is associated with acute toxicity in high doses, and it does not prevent measles, only the vaccine does that. So for unvaccinated individuals who are exposed, there is post-exposure prophylaxis within 72 hours. And the incubation period for measles actually is 7 to 14 days. And if the vaccine's not an option because you're immunocompromised or you're pregnant, there is immune globulin that can be given through an intramuscular injection or intravenously. So the last thing I want to say is that the MMR and MMR vaccine, it's been unchanged for 50 years, and there's billions of doses that have been safely administered globally since its introduction. Now, parents may ask why infants less than 12 months don't receive MMR. It's not a safety issue. The reason is because maternal antibodies may reduce the effectiveness of the vaccine, but those maternal antibodies are not enough to protect from severe disease. So this vaccine is safe to give in babies 6 months to 12 months if needed, but the extra dose doesn't count towards your routine series. Now in Houston and most of the Southeast Texas region, we haven't had any linked cases to the West Texas outbreak. So an early MMR dose probably isn't necessary at this time, but parents definitely can choose to give one. Adults can also receive an extra MMR dose if they're concerned. There is no safety issue. And if a child has already received MMR, the second dose can be given if more than 4 weeks or 28 days has passed, and that actually will count towards the second dose. And with that, I'll pass it on.
Dr. Chang, let me ask you one question that has been asked of me a lot. So if I am a parent and my child has not been immunized, but I'm thinking, well, this is dangerous now, what's going on in West Texas, let me be safe on this one. How long before that immunization probably takes effect where I could feel safe about my child being immunized?
Yeah, so we know that the peak antibody level develops about 2 weeks after immunization, similar to most other vaccinations. And so that actually lines up pretty well with the incubation period, which is why vaccine is still the preferred version of post-exposure prophylaxis. So for parents of babies over 6 months, if they're concerned, if they're in relative proximity to West Texas, they can certainly get a vaccine safely and early. Again, the less than 6 months, so if we go down one more bracket in age, again, it's not a safety issue. The main concern is efficacy. And so if you give that dose in less than 6 months, those maternal antibodies are going to keep the vaccine from working, but again, are not enough to protect you from severe disease. So really, from 6 months and on, if parents are concerned, I would recommend getting an MMR vaccine, not a safety issue. And that's still the only way really to prevent measles.
Thank you so much, Dr. Chang. Y vamos a regresar a Dr. Segura en algunos momentitos para hablar sobre esto también. But first, let's go to Dr. Gilbert Handel, who's out in El Paso. at the Texas Tech University Health Sciences Center there and is a pediatrician. Y Dr. Handel, if you can hablar un poco en inglés y después en español alguna palabra. What is your take on this, Dr. Handel?
Desgraciadamente nosotros hemos sido víctimas de nuestro éxito. We have been victims of our success. I don't know how many people in the panel have seen, maybe Terry have seen measles, but many people have never seen measles. In the mid-60s, I was in charge of a ward with measles. And we saw the main complication, pneumonia, and I saw death. I saw deafness, I saw blindness, I saw encephalitis, I saw children dying. And it was terrible because not only they die, but they also, after the measles, their immunity is decreased. Una vez que le da sarampión al niño, muchas veces la inmunidad completa del niño baja al punto de que es muy susceptible a tener infecciones bastante graves. Yo estuve a cargo de un piso entero lleno de niños con sarampión y vi las complicaciones más serias que ustedes no se imaginan porque no lo han visto. Los abuelos probablemente lo vieron, pero incluso los padres no lo han visto y nosotros, como decía, somos víctimas de nuestro éxito. En El Paso, lo mismo que decía Marcha, la gente es muy receptiva a vacunas y tenemos un índice de vacuna, un promedio del 93-97%, dependiendo del distrito. Sin embargo, hemos visto un aumento 3 veces más de gente que tiene resistencia a las vacunas. Y la resistencia a las vacunas se debe a que un médico, entre comillas, médico, Wakefield, empezó a relacionar el autismo con la vacuna de sarampión. Y ese hombre, fíjese, fue tanta la desgracia que hubo 18 investigaciones que todas las investigaciones descartaron la relación entre autismo y la vacuna, todas. Pero este hombre siguió insistiendo y desgraciadamente ahora está practicando, entre comillas, practicando en Austin, en nuestro estado. Pues. Imagínense, y la gente lo está siguiendo. Y la comunidad en donde él está tiene una inmunidad de protección bastante baja. Eso desgraciadamente, y el hecho de que la gente no haya visto sarampión, no haya visto polio, no haya visto otras enfermedades, tiene cierta reluctancia, cierta resistencia a que le ponga la vacuna al niño, porque dice, bueno, ¿para qué le voy a poner si no le da la enfermedad? Y la enfermedad, como usted lo ha dicho, todo el mundo lo ha dicho, tiene una infecciosidad tremenda. O sea, un niño con sarampión puede infectar a 20 sin ningún problema. A cualquier persona la exposición es enorme. El doctor Cheng explicó la parte clínica, pero déjeme asegurarles que la parte clínica, cuando usted ha visto un caso de sarampión, vio un caso de sarampión, son todos diferentes, pero la gravedad de la enfermedad es seria. Because unfortunately, people have not seen bad diseases, infectious diseases that are prevented by vaccines. I was saying we've been victims of our success. We need to continue immunizing children. If we don't immunize our children, we're going to really see an upsurge of these immunizations. The best example, for example, is polio. Well, polio was almost eradicated in Africa and Mid-Asia. Now we have an upsurge because they decreased the number of immunizations. We don't have to go through that. We have eradicated measles, was practically eradicated in the year 2000. Why we have to go back again to having cases of measles? The problem with that immunization is that the herd effect means that we are protecting people that cannot be immunized. People that are on chemotherapy, people that are cancer, people that are really not protected or they have lost their immunity, they have to be protected by us. We can be protecting them indirectly. So we need 95% of the community to be really immunized to really protect the community. That's called the herd effect, o control del rebaño. La parte clínica es evidentemente, yo puedo hablar una hora de la parte clínica de los casos que vi en el piso, porque cientos de casos desgraciadamente. Y lo más serio fue cuando tuve que ir a una isla en el sur de Chile, una isla de Chiloé donde no había inmunizaciones y los niños estaban muriendo. Llegamos con la vacuna, en un mes se acabó el sarampión. O sea, es el ejemplo más dramático del completo término de una pandemia realmente, simplemente con la inmunización. Es una vacuna altamente efectiva. En esos años no teníamos la vacuna de MMR, teníamos la vacuna del virus muerto, que no tenía la misma efectividad del MMR. La vacuna de MMR ahora con una dosis protege 92%. Con 2 dosis protege el 97% de la gente. Entonces la protección es extraordinaria. Y MMR es una vacuna que realmente en este momento yo no consigo a nadie no inmunizando a su hijo. Es casi abusivo no inmunizar al niño. The vaccine has a very good protection. We used to use the death vaccine, but in 1970 something, mid-70s, we decided to go with the MMR with the live vaccine. And the live vaccine protection was much higher, to the point that the measles was considered almost eradicated in this country about 20 years ago. And yet we have the problem now. There are a surge of cases because of communities of people that are not getting immunization, or the herd effect. Herd effect means that the community has to be immunized up to 95% of their. But I'm delighted to answer questions. I've had so much experience with measles, and from the inception really of the disease, that I'm delighted to share my experience with anyone.
Thank you very much, Dr. Handel. So appreciate you being here today from El Paso. From El Paso, let's go to Houston. Dr. Janina White is here. She's the Deputy Public Health Authority at the Health Department in Houston. Dr. White, obviously, maybe not a case yet in Houston, but you guys are extremely worried about this. Give us sort of your thoughts around measles and Houston and Texas.
Well, thank you for having me. And again, the speakers, thank you so much for the information. It's been amazing. And Dr. Handel's point, many of us, I'm a pediatrician and an internist, have never seen measles, but of course, training, we had it in our, what we call our differential when we saw a kid with a rash. So here at the Houston Health Department, our teams are focused on prevention, and we're participating with these weekly calls that happen at the local, state, and regional level to really work with our partners and share information. And again, monitoring what we're seeing in West Texas. We're testing for measles through our wastewater, though, so we're very excited that we have a surveillance system. We're a center of excellence in Houston, so Houstonians, you should be so proud of the work that our teams are doing around monitoring for measles. We have 36 wastewater treatment plants that we look at. 48 have manhole sites that we monitor, and we just recently started monitoring for 45 school districts, 45 HISD schools, and also some neighboring districts as well that have low vaccination rates. We're also looking at vulnerable populations, so we're paying attention to our shelters. We're looking at 9 shelters, 8 nursing homes, and we're also looking at 2 of our jails. We're committed to working with our local providers as the health department, and we're ensuring that those providers really leverage what we call vaccine access, what we call vaccines for children access, and the adult safety net vaccine access. And we're really asking the providers to look at how to have alternate hours for individuals to come in to get vaccinated, do walk-in clinics, reduce your fees, really look at getting new patients in. And then, government public health, what we know is we really have to leverage a lot of partnerships. More importantly, we really are targeting our school districts and our daycare centers. So those that have sort of low vaccination rates, similar to what Dr. Handel said, if you don't have that herd immunity, we're really partnering with them to see what can we do to get those kids vaccinated and really help educate parents and family members on the importance of what it means to have that herd immunity. Again, Dr. Griffin mentioned, there will be individuals that won't be able to be vaccinated. So if we can really wrap around them with really having the community vaccinated at its highest level, we're helping protect those individuals. We also know that the vaccine is safe. So we're really pushing out a lot of information and messaging in multiple languages, amplifying that narrative that vaccines are safe, MMR is safe, and also that the best way to prevent measles is to get vaccinated. All of our information that we're doing now, we are ensuring that it's in multiple languages, and we're really targeting providers. Again, many have not seen it, so we're trying to make sure providers know the early warning signs. If our wastewater gives us a uptick or a signal, we certainly want providers to know how to best protect their clinic environment, but get the patient seen. And so I just really want to share real quickly our phone number for providers who might need additional support. It's 832-393-5188. And then for the general public, if you have any questions, we have a call center always manned, and we're here to answer any questions that you might have. Our number is 832-393-5427. So again, thank you so much for inviting me.
Thank you very much, Dr. White. So appreciate it. Vamos a hablar ahora con Dr. María Gabriela Segura, en español. Doctor Segura, ¿nos puedes hablar un poco del el sarampión y las cosas más importantes para nuestras familias?
Sí, ¿cómo está? Bueno, como todos han dicho en inglés, el sarampión es una infección que es muy, muy contagiosa. Generalmente afecta a los niños, pero también puede afectar a personas adultas que no estén inmunizadas. Los síntomas principales que vemos es fiebre muy, muy alta, más de 39 grados centígrados o más de 104, 105 Fahrenheit. Los pacientes tienen tos seca, tienen coriza, que es como mucha congestión nasal, y conjuntivitis, que es rojo en los ojos. La erupción normalmente sigue estos síntomas y aparece desde la cabeza hacia los pies. Es una erupción que es muy roja, un rash en la piel que es muy rojo. Y bueno, lo que vemos normalmente es que la fiebre empieza, una vez que aparece la erupción, la fiebre empieza poco a poco a ceder. ¿Qué debemos saber sobre cuándo buscar ayuda si pensamos que nuestro bebé o nuestro familiar tiene sarampión? Pues es importante saber que tenemos que buscar atención médica si han pasado ya varios días y los síntomas no están mejorando, si el bebé o el paciente no es capaz de estar bien hidratado, es decir, no está tolerando los líquidos, si tiene algún cambio en su estatus mental, como convulsiones, confusión, eh, en esa categoría, y si tiene dificultad para respirar o dolor en el pecho. Esos son los síntomas que nos deben llevar a buscar atención médica. Por supuesto, como el doctor Chan había comentado, si tenemos sospecha de sarampión, es muy importante comunicarlo al doctor que nos esté atendiendo porque necesitamos unas medidas de contener al paciente diferente. El sarampión no tiene un tratamiento específico, es un virus, no es una bacteria, así que no se puede tratar con antibióticos. La mayoría de las veces tratamos de dar tratamiento sintomático, que significa tratar los síntomas que tenga el paciente. Si tiene fiebre, tratamos de manejar eso con acetaminofén o ibuprofeno, tratamos de que el paciente esté bien hidratado y tome bastante líquido. Y bueno, con respecto a la vitamina A, que es algo que está sonando bastante ahorita, pues es importante recalcar que sabemos que la vitamina A tiene ciertos efectos en disminuir la mortalidad y las complicaciones del virus en aquellos niños que tengan deficiencia de la vitamina o que estén desnutridos. Pero no sabemos bien los efectos de la vitamina A y el sarampión específicamente en las personas que no tienen ninguna deficiencia nutricional. Y también, y la otra cosa que sí sabemos es que la vitamina A también tiene ciertos efectos secundarios cuando damos dosis muy altas, que pueden llevar a complicaciones serias como alteraciones en la visión, alteraciones en el cerebro, daño en el hígado, entre otras cosas, y también para las mujeres embarazadas, muy importante que puede causar malformaciones en el feto. Entonces, es importante eso, recalcar que la vitamina A no va a tratar el virus en personas sanas. Para aquellas personas que tengan alguna exposición de sarampión y confirmada, pues podemos colocar la vacuna hasta 72 horas después de esa exposición. Y para aquellas personas que no se pueden vacunar porque están embarazadas, sean inmunocomprometidos o tengan algún otro factor que no les permite colocarse la vacuna, está la posibilidad de la inmunoglobulina en este tipo de casos especiales. También quería hablar sobre ciertos mitos que hay con respecto a la vacuna, sobre todo para nosotros los hispanos, que pues hay muchas cosas que nuestras abuelas nos dicen y como que tendemos a seguir repitiendo. Pues bueno, como han dicho ya todos, la vacuna es segura, la vacuna está en el mercado desde hace más de 50 años, hemos administrado más de 2 billones de dosis y los efectos adversos normalmente son leves, fiebre, algunas personas tienen algo de erupción, dolor en el sitio de administración, pero los efectos severos en realidad son muy pocos. Y es una vacuna muy efectiva, como también hemos dicho, después de recibir las dos dosis tenemos hasta 97% de cobertura con la vacuna. Otro mito que yo siento que es importante aclarar para nosotros, repito, los hispanos, es que la vacuna, es que es mejor que los niños se enfermen y adquieran la inmunidad a través de la enfermedad. Pues esto es una idea muy peligrosa porque aunque el sarampión puede parecer leve en algunas personas o en algunos sitios, hay números, hay casos de personas que desarrollan complicaciones severas, neumonías, encefalitis, hasta la muerte. Y por supuesto, ninguno de nosotros queremos que nuestros hijos formen parte de esos números. Entonces, la vacuna siempre va a ser la manera más segura y efectiva de prevenir estas complicaciones y es vital para poder parar que este virus se continúe expandiendo.
Doctor Segura, una pregunta. Como hay padres que tienen preguntas sobre la vacuna y otra vez, y yo sé que, I know you answered this, pero si un padre tiene la pregunta, ¿los vacunas son seguros? ¿Cómo es, qué dice usted sobre eso?
Sí, y esta pregunta nos la hacen, pues yo creo que a todos nosotros. Por supuesto que las vacunas son seguras. Nosotros como pediatras y como médicos lo único que queremos es que nuestros pacientes estén bien. Y algo que estaba diciendo la doctora Burke que me pareció, que yo siempre le digo esto a mis pacientes, es, nosotros no podemos controlar muchas cosas de las cosas que están pasando el día a día, no podemos controlar accidentes de carro, no podemos controlar tiroteos, lamentablemente en el mundo en el que estamos hoy. Lo que sí podemos controlar es proteger a nuestros niños en la posibilidad que tenemos. Y en este momento en específico, eso significa la vacuna. Nosotros no estaríamos apoyando una iniciativa que fuera peligrosa para nuestros pacientes, porque al final eso es nuestra prioridad.
Y doctor Seguro, para inmigrantes, para los que tienen miedo para ir para el hospital para una vacuna, ¿qué es la cosa que tienen que saber ellos sobre su seguridad y la inmigración?
Pues es súper buena pregunta en estos momentos. Nosotros no tenemos ningún tipo de obligación ni estamos interesados para nada en el estatus migratorio de ninguna persona que venga a nuestra clínica a recibir una vacuna. Yo le diría a todas esas personas que la seguridad de los niños está por encima de todo y pues siempre hay que advocar por nuestros pacientes y por nuestros hijos y que no dejen que ese miedo los detenga porque en realidad nosotros no estamos interesados en eso, nosotros solo queremos proteger pues a toda la población.
Gracias. Dr. White, I wanted to
Gracias.
ask you very briefly, because we're talking about immigration, uh, and it's a delicate area when we talk about immigration these days. And I wonder, as you're monitoring places, are some of the immigration facilities, one of the places that you guys are monitoring, Dr. White?
That we have shelters, but the
Yeah.
nature of the shelters, my understanding, may not be one of those. They sit under different jurisdictional kind of compliance in a way.
Yeah.
But I mean, that's a great consideration. So we know, though, we're trying to get the information out to as many people as possible, though.
Yeah, I think one of the things that we all need to understand is that we're talking about a public health issue right now. And the idea is that we want to get every child to be protected, every child to be healthy. And so for us, it's not about trying to create a political issue here. It's really trying to keep kids safe. I think that's the
Absolutely.
thing. Yeah, very good. Yeah, Dr. Griffin, you want to add one thing to that? And you're on mute, so might need to take yourself off.
Thank you. You know, immigration is my issue. Immigrant families are who I've been seeing my entire career. And I need to make it clear that almost all countries, not all, but all countries vaccinate for the measles. And so immigrants coming in, like they were asking Terry and I, they are not carrying measles. That the only measles cases we had was back when we were closing down the Afghani war, and we had refugees coming in, and not all of them were vaccinated. And we saw some measles cases back then in Chicago. Other than that, you are not seeing measles in immigrant families that have been seeking asylum on the border. It just doesn't happen.
Yeah. Yeah. I often like to point out that when we had a surge in children coming across our border not too many years ago, when we looked at vaccination rates, they were indeed often higher than American vaccination rates. So it's
Absolutely.
yeah,
Absolutely.
so it's an interesting thing. I want to thank all of you for being here today, and I know we said we keep this to 30 minutes, so thank you very, very much, Dr. Griffin down in the Valley, Dr. Chain, and Dr. Segura at UT Health, Dr. White at the Houston Health Department, Terry Burke, who's with the Immunization Partnership, Dr. Handel, who's at UT in Texas Tech in El Paso. So thank you all very, very much for all of your work. And I know that you're all available to the press if they'd like to follow up. And we'll just wish for the best, but we'll do our darndest in the meantime to protect our children. So thank you all very, very much.
Thank you so much.
All right, thank you guys.